The COVID pandemic affected the lives of all Americans. Rural communities are particularly vulnerable due to lacking mobility services and the great distances one must travel for health care and other needs. Nearly 5 million veterans live in these rural communities, representing 57% of VA healthcare enrollees. COVID-19 cases and deaths among rural veterans have increased at a faster rate compared to veterans in urban areas, according to Johns Hopkins in 2020. They also found that delayed COVID-19 testing contributed to a higher rate of cases in rural areas compared to urban areas as well. Hi, my name is Del Peterson. I am Associate Research Fellow at the Upper Great Plains Transportation Institute at North Dakota State University. I work with the Small Urban and Rural Center Mobility, CIRCOM. We recently completed a Veterans Mobility and COVID-19 study. The main objective of this research was to identify veterans living and affected by COVID-19 who had mobility needs living in rural areas, quantifying the cost of transportation options for meeting their needs. Secondary objectives include analyzing the role of telehealth and how the pandemic affected mobility and isolation among veterans in rural America. We also took a cursory look at how access to food impacted veterans during the pandemic. We designed an online survey to be distributed to veterans. Surveys contain questions focusing on veteran travel patterns, food security concerns, mobility issues, and changes in medical and general travel patterns during the COVID-19 pandemic. The survey was distributed by email to veteran service officers and Veterans Affairs representatives throughout North Dakota, South Dakota, Minnesota, Iowa, and Nebraska. Smaller rural areas were targets, as the metro areas of Minneapolis-St. Paul, Des Moines, Iowa, and Omaha, Nebraska were excluded from the survey. Representatives were asked to forward the survey onto veterans living in their service area at a county level. A total of 150 viable surveys were received. Disabled veterans were first asked to specify the nature of their disability. This question allowed for the indication of more than one disability, with a number of veterans selecting more than one. Veterans were also asked how far they traveled to veteran healthcare facilities. The question allowed for indication of more than once, but found that roughly one-third of participants indicated they traveled 30 miles or less one way to veteran healthcare facility. Just over 20% indicated they traveled 31 to 60 miles, where nearly half of veterans responded that they travel more than 60 miles one way to receive medical services. Final section of the survey, then we asked veterans about their experiences during COVID-19 regarding safety and food security. Food security was found to be an issue for 8% of veterans responding to the COVID-19 pandemic within the survey group. Food insecure veterans live mainly in very remote areas with limited access to services during the pandemic. When asked about the reason for food insecurity during the pandemic, 90% indicated that restaurants were closed, while 50% indicated that stores were closed as well. 30% designated either the inability to purchase food online or a lack of finances for their insecurity. Finally, 30% of respondents also indicated not being able to wear a mask as a cause for food insecurity, as their local grocery stores were requiring them to enter their businesses. 20% reported that food security was due to a lack of transportation. Simulations were also ran and completed from a transit agency perspective to predict the number of veteran passengers required for veteran service healthcare centers and medical trips for transit fares recovery levels to be equaled or exceeded. Simulations were conducted for transit agencies that serve veteran healthcare centers in Fargo, North Dakota, St. Cloud, Minnesota, Mankato, Minnesota, Sioux Falls, South Dakota, as well as Norfolk, Nebraska. Sensitivities within these simulations focused on targeting fare recovery levels for all 5 different VA healthcare centers as well. These simulations and findings build on previous work conducted by myself in 2014. Most simulations did show that a coordination effort between VA medical centers and rural public transit agencies would be feasible if projected ridership levels could be met. Policies to encourage possible coordination should be considered to improve veteran transportation services. The most challenging obstacle continues to be transitioning of veterans that are now mainly in their late to middle retirement age away from their own personal vehicles to other more long-term sustainable transportation options, including public transit. Thank you, and here's my contact information. Please feel free to contact me if you have any questions.